Hello, everyone. Today we're going to be talking about mindfulness based interventions, psychological benefits, mechanism, practical applications. My name is Santiago Pena, and this is the introduction. The issue concerning mental wellness, such as stress, anxiety, depression, and burnout, are increasingly being witnessed among children, adolescents, adult, uh, adults, and professionals. As not many can afford protracted counseling, and medications. Psychologists tend to explore alternative interventions that work well, are safe, and more affordable. Mindfulness is one such as alternative. For instance, there have been initiatives by schools to allow mindfulness programs among children during examinations to alleviate anxiety and enhance concentrations. It is a uh, growing worldwide concern about mental health, demand for available and evidence-based resources, and mindfulness can benefit any age group. What is mindfulness? Mindfulness is being present to what is actually taking place at this moment rather than being caught up in one's thought, worries, and other distractions. Mindfulness also teaches one not to judge oneself regarding what one feels and thinks. For instance, if one feels angry, one wouldn't say, I should not feel this way, but rather say, I'm feeling angry at this moment, which lessens pressure rather than increasing it. Present moment awareness, accepting thoughts and feelings, observing without judgment. Background and origins. The ancient roots of mindfulness can be traced to Buddhist cultures, but it is more contemporary because it only became accepted within Western medical circles with John Kabat-Zinn's introduction to mindfulness-based stress reduction, or MBSR, in 1979. Originally developed to treat patients coping with long-term pain, which could not be controlled by pain medications, a patient with back pain could use mindfulness to watch their pain rather than tense up in response to it. Traced back to Asian meditators, developed into psychology by John Kabat-Zinn's development of MBSR program. Types of mindfulness based on interventions. The types are MBSR, MBCT, which I'm sorry, MBSR means stress and pain reduction. MBCT means prevent depressive relapse. ACT, values driven behavior change. Online and app based programs. MBIs work to accomplish different aims. The purpose of MBSR is to decrease stress that is both physical and emotionally charged. The objective of MBCT is to use mindfulness along with cognitive behavioral therapy to keep episodes of depression at bay. The main intention of ACT is to increase acceptance of negative bodily experience while also acting according to personal values. For instance, someone with fear of presentations can use ACT to give presentations. Core components: meditation and amp breathing, body scanning, thoughts observation, daily repetition, and practice. Most mindfulness classes will involve meditations to observe one breath or bodily sensations. They will also train ones to identify their thoughts rather than acting on them immediately. It is crucial to practice these each day no matter how short a period one can commit. For example, one can start each day by taking a 3-minute breathing exercise to center one's mind while his way to school. Psychological mechanism enhances emotional regulations, reduces reduces rumination, improves attention, fosters healthier response. Mindfulness helps the brain manage emotions and thoughts more effectively. By pausing before reacting, individuals make better decisions. For example, someone with social anxiety might normally avoid social situations, but with mindfulness, they notice that anxiety, breathe through it, and still attend the event instead of avoiding it, which will help a lot how to control problems, or if you get anxiety when you're out with people, it will make the situation better. Evidence-based outcome anxieties reduces anxious thoughts, reduces physical stress response, may aid in dealing with worry cycles. Research shows that mindfulness can lower anxiety. I have seen that mindfulness can lower anxiety because mindfulness helps people stop the habit of overthinking, and mindfulness soothes the system. For example, a mindfulness breathing exercise can beat the test anxiety than a teenager. So the mindfulness has proven that it can actually lower anxiety and stop people's habits of overthinking, or stop the stress, makes the stress more, how do I say it, fixes the stress responses far better than without mindfulness, which you can control problems or hard situations where you can find yourself in. Evidence-based outcomes depression. Mindfulness-based cognitive therapy has been shown to decrease the likelihood of depressive episodes by training those affected to detach themselves from negative thoughts. A person might respond to a thought like "I am not good enough" by saying "I am I am not good enough" by saying "this is just a thought passing through my mind," which halts escalating emotions. Reduces relapse risk, increases positive coping, supports mood stability. So, mindfulness has also proven that it can actually help depression. So, it can fix your attitudes, your moods, makes you stop giving up, and you can push yourself more by not having depression thoughts, and it makes pretty much your life better. Effective across populations. Students, healthcare professionals, caregivers, and workplace employees are some examples of who it affects and how it affects it. MBIs work well in different settings. MBIs are practiced by students to concentrate and to keep their emotions balanced. MBIs help nurses avoid feeling depleted, while caregivers employ MBIs to counter stress and exhaustion. To clarify, hospitals provide mindfulness breaks to allow nurses to take mental refresh before continuing work. So it is proven that mindfulness actually helps at work. If you're stressed, if you're depressed, exhausted, it actually helps them calm down and think more about it, concentrate more when they come back. So it is really, really good. Strengths: affordable and available, can be practiced everywhere, anywhere. Long-term skill building combines with other therapies. One of the things about mindfulness is that mindfulness needs no medication and needs no technology. I have found that a person can add mindfulness to their routine, including at home, at school, at work, or outside. Mindfulness works anywhere. I have also seen a person open up the mindfulness app at lunch and use mindfulness to center the mind for the rest of the workday. So you can use it anywhere and everywhere. Limitations: I have seen mindfulness help the mind. Mindfulness only works when you practice mindfulness often, like you do with exercise. Some people want results right away. Some people quit soon. For example, the person may feel frustrated because meditation feels boring at first. I've watched the person keep trying. With repetition, meditation becomes easier and more helpful. Also, the person with trauma may need therapy with mindfulness. Mindfulness alone is not enough for the person. Requires requires consistent practice, not a quick fix. Not always suitable alone, and some individuals experience issue with concentration. Real world, real world applications. Mindfulness fits into programs. Mindfulness helps the whole system work better. For example, some prison will now add mindfulness training. Mindfulness training cuts aggression for the inmates. Mindfulness training cuts impulsivity for the inmates. The inmates show behavior. The inmates also show stability. School and universities, hospital and therapy office, workplace and military, and rehabilitation and recovery centers actually also have it. In conclusion, mindfulness based intervention represents an effective tool that helps to gain mental strength and self understanding. Mindfulness is an addition to one's life that improves life quality, but it is not a replacement for any kind of medical care. Individuals can work on improving their concentration and self control using simple exercises on a daily basis. Research shows effectiveness aids mental, physical, and emotional health, valuable long term life skills. Thank you.